With this presentation, going to be looking at caffeine and how it affects sporting performance in both a positive and negative way, and the regulations of the NCAA regarding caffeine intake. Caffeine is a crystalline compound which stimulates the central nervous system when ingested. It is the most commonly consumed drug in the world, found in a large majority of everyday food, drink, and over-the-counter drugs. Examples of the caffeine content of many everyday drinks that are consumed can be seen in the table shown. The effect of caffeine consumption on athletes has been studied in depth to examine if there are benefits of consumption. It has been shown that caffeine has the capability to increase work output levels and increase the time to exhaustion in endurance performance. Further enhancement has also been shown in performance of short-term, high-intensity cycling and running, lasting in duration of up to 5 minutes. A variety of athletes can benefit from caffeine consumption to improve their performance. Those competing in events including endurance, strength, power, and sustained high-intense activity can gain a competitive advantage. Further study has also shown athletes partaking in team sports involving intervals of work and a required skill set, such as soccer, basketball, and rugby, can also benefit from caffeine consumption. The recommended level of caffeine consumption to give an increase in performance of trained athletes is between 2 to 6 milligrams per kilogram of body weight, consumed 60 minutes prior to performance. During performance, consumption of 0.75 to 2 milligrams per kilogram is sufficient in order to maintain the level of performance. There are, however, disadvantages of caffeine consumption. Acute consumption from athletes who are sensitive to the effects can suffer from excessive stimulation of the central nervous system, with the resulting effects listed. Diuretic effects are also common, which can potentially lead to dehydration, leading to a decline in level of performance. Restrictions have been placed on the level of caffeine athletes can consume within the NCAA. A tested urine level which exceeds 15 micrograms per milliliter will result in a ban from participation in any NCAA competition. More information can be found on the websites of Drug Free Sport and the NCAA on caffeine consumption and how it affects performance.